diagnosed at 3 years old.
When I was 9.
About 12 years old.
I was 9 years old.
I remember being very confused because at the time I didn't know what diabetes was. And it was a scary experience, I would say. I didn't like needles at the time, so.
Well, for a while it was a bit sad. I still sort of am, but I'm sort of getting through it.
Being 9, I just kind of didn't know what was going on. And I had a lot of brain fog too, so that didn't really help out. But eventually I kind of realized what was going on and I didn't feel as scared. But well, it's important to control your blood sugar levels because if it's too low, you can have seizures, you can pass out, you could die. And if it's too high, you can go into diabetic ketoacidosis, which is basically where your blood turns acidic.
Because without taking my insulin and stuff, then I can go into something called diabetic ketoacidosis, and that basically sends me into a coma, and then I will most likely not wake up.
So currently I wear an insulin pump, and so that's constantly giving me some insulin. And then when I eat, I punch in how many carbs I'm eating, and then it'll calculate another bigger dose of insulin.
I have a T1D pump, it's a brand, and it regulates my blood sugar. I have this on my arm, regulates my blood sugar, and I have a site on my stomach, and it gives me insulin through the site on my stomach.
So I don't prick my finger since I have a glucose monitor, but I'd say I probably check my glucose monitor like 50 times a day.
50-ish, maybe.
Usually 3 finger pokes a day. And then my Dexcom is checked very often.
We have some ketones starting to build up, which is what happens when you're about to go into diabetic ketoacidosis. So that's not very good. You would have to give a lot of insulin to try and bring that down. You would drink water to kind of flush yourself out, and just wait and see what the insulin does.
Usually I will dose and drink a lot of water, and usually check for ketones unless it hasn't actually been that long.
I don't know if you would be conscious or not, but if you were not, you would have to get a glucagon dose. So that's either like a little nasal medication or there's an injection too. But if you're still conscious, you could try and eat or drink something really sugary to bring your blood sugar back up.
I usually take my pump off in that case, and I also have to eat quite a bit of sugar.
I would check my blood sugar again. I would most likely have juice, then check within the next 5-10 minutes, and then have more juice.
So when my blood sugar is high, I kind of feel really tired, sometimes cranky, but usually not as bad as when I'm low. I feel just really kind of out of it. I also get really cranky when I'm low too. So
If I'm low, I'm typically more, I have to focus more, so I'm kind of more serious, probably, I would say. And then when my blood sugar is high, I have, like, I'm kind of hyper.
When I'm high, I can get kind of like annoyed, I guess. And when I'm low, I don't really know what's happening.
during practices, it's not as hard to manage because I kind of know what's going to go on. I know that I'm not nervous, but during games, nerves can raise your blood sugar, but then also exercise drops your blood sugar. So it's kind of a hard balance, to try and guess how much insulin should I give before. There's a lot of factors.
Well, I play softball, and so every time I go to practice or I play a game, I take my pump off for it, and I just don't bother wearing it until after activity is done.
In PE, sometimes I have to participate more than normal if my blood sugar's high, or if I'm low, I have to sit back and relax and participate less than the rest of the class.
I'd say on a good day, probably 7. But if my blood sugar is low, sometimes it can go low like 3 or 4 times a night, maybe 5.
7 or 8 on a good night.
What about a bad night?
Like 4 or 5.
Probably like 7 or 8, and then like bad ones, I've had like 3 or 4 before.
6, 7-ish, I would say.
On a good night, maybe like once or twice, maybe 3 times. On a bad night, like 9 or 10 times.
Yeah, so it depends on the day. Sometimes you can sleep, a full week without your alarms going off, but some days it'll just keep going low every hour. So I think it really depends.
Roughly 50-ish units.
50 units?
I believe it's around 40 to 50 units.
I use about 50 units a day, which is like a 20th of a vial of insulin. I don't know the exact production cost, but I do know that the first patent was sold for only $1, and now I pay probably $400 per vial.
I've heard it's pretty cheap to make, but then they resell it for way past its selling, or its manufactured price.
I need a 504 plan for my diabetes, but and my 504 plan basically lets me get water, use the bathroom whenever I want. If my blood sugar is low during a test, then I have the choice to just like stop taking the test right then and there and like continue it later or retake it later.
Well, when I'm like low and stuff, I can't really focus, and then when I'm high, I also can't focus, and when I'm high, I get headaches and stuff, so I basically can't focus on my work and do that. And when I'm low, I have to constantly check, and then it keeps interrupting me constantly.
So this one's kind of special because when I was in middle school, I was kind of scared of showing off my diabetes because I was worried that people wouldn't want to be my friend. But as I've gotten older, I kind of realized that, like, if they don't want to be my friend because they have diabetes, like, I don't want to be their friend anyways. So I'd say it kind of made me realize who my, like, true friends are. And also it kind of can complicate social situations. Like, I can't just, like, on a whim, like, go with my friends somewhere without thinking, like, do I have my diabetes bag? Do I have juice? Is my blood sugar okay? Like, what's gonna happen?
My friends have had to like wait for me or like other things in the past because like my blood sugar was too low, so I couldn't walk around with them or anything. So, or like I'd have to go buy food and such. So I feel kind of bad because everyone around me is affected by my disease.
My friends, I mean, they know, but they don't really. It's not like super important to them. But that's really it. Well, I mean, my friends sometimes will scooch away from me, or like, I guess it's not really making fun, but it's like they'll scoot away from me at the lunch table when I do my insulin.
Like, especially when you're younger, you kind of get bullied for it and such. Like in kindergarten, I used to sit in my classroom during like the second recess or whatever it was, and I used to just like eat a snack in there, and I got comments from kids a lot. So
Been a few times where my phone's just like gone off in class because my blood sugar's low. Everyone like turns their heads and they're like, "Oh my god, like put your phone away, like what is that? And also, just sometimes it's awkward when you're in like a big group setting and like your alarms go off or your blood sugar's low and you're like, sorry, I just have to like drink this juice box like really awkwardly. I kind of mentioned how when I was in middle school, I kind of hid my diabetes because I was worried, like, oh, like I'm meeting all these new people, like, will they want to be my friend? Because I have diabetes. So I'd say when I was younger, that was more of an issue, but no, I've tried not to care as much.
I used to feel that way when I was really younger, and I took shots until I was about 10 years old because I really didn't want to have anything on my body like that, and I felt like I was going to be judged for it.
Well, I think that there's just a lot of misunderstanding. I think a lot of people think that diabetes is a disease that you get when you're overweight or you eat the wrong things or you don't exercise. But really, that's type 2 diabetes. And I think knowing how type 1 diabetes is different is really important and that, it's a chronic illness, you really did nothing to get it.
I'd say 1, it's not a disease that you get from being fat. 2, sugar saves lives. And 3, there are 2 different types. There's type 1 and type 2. Type 1 is something that you can't control. They don't know how you get it. It could be genetic. It could be vitamin D deficiency. Type 2 is more in older people. And that just comes with old age.
It's not, it sucks, and I guess be glad you don't have it. I don't know.
Use a glucagon. Could save a diabetic's life.
It does not hinder us from eating cake or playing soccer. It's just something that is there and needs to be worked on in those situations.
Enjoy eating without dosing.
There's a lot more that goes into it than just like wearing an insulin pump. There's a lot of mental aspects and a lot of like planning.
Just being patient, I guess, especially if like I know I keep using the excuse of if my blood sugar's low, but you're pretty functioning if your blood sugar's high. So if it's low though, it's way harder to like move and like I get super shaky and everything. So I kind of just have to sit down and wait a bit until my blood sugar goes back up. So it's kind of being patient.
From a social perspective, to be nice.
I guess just be there for me when I need them or stuff and such. I don't.
I'd say checking in, sometimes I'll be having like a really bad diabetes day and my blood sugar will just like keep going low and it'll go high and it'll go low again. So I'd say just, having a friend there that knows what diabetes is and is able to, check in and ask like, hey, how are you doing? I think that's really valuable.